Thank you so much, Councilmember Balducci. And again, for the record, I'm Ingrid Ulrey. I'm actually the Policy Director for Public Health Seattle-King County. I have some information to share with you about our regional plan to vaccinate all older adults as quickly as possible. I have information I think you'll find interesting and relevant, and I'm happy to pause at any time that you want to go deeper or speed along in things that are less pertinent to you today. So I just want to respect your time. There's just an incredible sense of urgency about this work because we know that when older adults test positive for COVID-19, they're just extremely more likely to become severely ill and die compared to younger people. So it's striking to me that while we have less than 10% of the overall COVID positive cases in King County are amongst people 65 plus, this age group accounts for nearly 85% of all COVID related deaths. So older people in our county have been really hard hit. Sadly, we've lost a total of 835 older adults in King County since the beginning of this pandemic. I want to share that my entire career has focused primarily on healthy aging, long-term care, and older adults. I'm very passionate about serving this population, and I'm just really honored to have been here at this point in history to help our health department think about protecting and saving lives as older adults who've been absolutely the hardest hit in this pandemic. I'm joined today in this presentation by an important colleague, Jeff Sakuma, who many of you know. Jeff is the Chief Integration Strategist, Health Integration Strategist for the King County Area Agency on Aging, which is housed in the Human Services Department of the City of Seattle government in the Aging and Disability Services. And Jeff and I have been working a lot together lately, along with many, many partners across our county to come up with a plan for how, as quickly, efficiently, and equitably as possible, can we reach the now eligible older adults. So the plan that we're going to share with you, it really echoes the overall regional unified regional strategy that Director Hayes has already shared. I'm going to sprinkle in it as we go through it some progress updates on our overall plan. And Ann Berklin is also here with us on the line from Public Health. And thanks to Ann and colleagues in our team, you have the regular weekly progress report on per the broader unified regional plan on vaccination, what's happened to date. So you have that in writing, and we will also share some key updates as we walk through this information. So essentially, Jeff and I are going to cover older adults, who's now eligible, what the data shows about their risk, and specifically, what is the size and scope of this population in King County and in our different geographies within the county, and then how we are applying the same multimodal vaccine delivery strategy for this population specifically that we're focused on for the population overall. And I really want to spend time talking about the intentional approach that we're doing with partners to reach the very highest risk older adults first and the most vulnerable, and take an equitable approach. And importantly, talk about ways that we are looking at how to make it as easy as possible for people to understand where can I get vaccinated and how do I sign up, which right now can be very challenging, as you all know, for a lot of people. So we're going to dig right into it. Jeff, I just want to give you a chance to say hello and maybe give people an overview of our now currently eligible groups.
Great. Thank you very much, Ingrid, and thank you for having me here at the council meeting. Again, my name is Jeff Sakuma, and I have been with the City of Seattle now for over 5 years. And obviously, one of my roles is my relationship and the contract we hold with public health. So all of the folks in public health are great peers, and I enjoy our working relationship. So we are obviously in sort of this whole phase process, and 1A, as all of you know, are all of the healthcare workers. And that includes folks who are also providing care to people in their homes. And so that's both paid and unpaid health caregivers in people's homes. The Tier 1B, Tier 1 group, 1B1, is sort of gets a little more complicated. Obviously, there is the straightforward group of people who are 65 years and older. And then there is the group of individuals who are 50 years and older living in multi-generational households. And really what we're looking at there is that we're looking at two sort of groups of folks. One are older individuals who are over 50 who live in a household with usually a son or a daughter and then their children as well. So there are sort of three tiers of generations. And they're living in that home for a variety of reasons, but oftentimes it's to also receive some level of care and support from those family members. The second group of individuals that meet this criteria are folks that we sort of follow what we call kinship individuals. And these are older individuals, 50 and older again, who often are caring for a child, and that child is often the child of one of their children who are not in the home. So those are the main folks that we are sort of focused on under 1B. Thanks.
Great. Thank you, Jeff. And Jeff, please feel free to just interrupt me at any time in this presentation and add to what I'm saying. Thank you so much for being with me. And if we could look at the next slide, that would be great. Before we go on to talk about how to reach this very large population of older adults and get them vaccinated, I want to say a word more about risk. One thing that's super striking is both from the national data and from our experience here in King County, the older someone is, the higher their risk. So this chart's a bit fuzzy. I hope you can see it. But from the CDC is showing that for the COVID-related risk for individuals who are older versus young people 18 to 29, pretty huge significant difference between the 65 to 74 age range versus the older age brackets. So you can see from this chart, someone who's in 65 to 74 has 90% higher chance of death, 5% higher chance of hospitalization than a younger person. Put your eyes and compare that to the 75 to 84 group, who are 220 times more likely to die than a younger person, and 8 times more likely to be hospitalized, et cetera. And it is even more severe for those 85 plus. This is played out locally in King County. I mean, as you all know, and I spent a lot of my time during this pandemic focusing on the outbreaks in long-term care facilities where some of our oldest residents live. Overall, we've seen 65, or really, if you round up, 66% of all deaths in our county have been individuals 75 plus. So really indicating that that older group is the highest risk. People at 65 to 74, about 19% of all deaths. This is sobering information, and I really wanted to take a minute to emphasize it for you because it is informing our strategy of how we prioritize the highest risk and try to put them first in the front of the line in different vaccine modes.
I'm going to jump in just for a quick second.
Yep.
Thank you for this. Do we have similar data broken down by race? Because there has been some reporting that individual different demographic groups, this would look different. That there are, by race, you'll see deaths at a higher percentage at younger ages, just as you see Latinx and Black groups and others who are having higher infection rates and higher death rates. Do we know, is that the case here as well?
Yes, and we definitely have a lot of good data prepared to illustrate the incredible disproportionate impact on communities of color, particularly Black and Latinx. And the two trends interface. So the very highest risk individuals would be older adults or BIPOC older adults, essentially. So that combination of higher risk that we're seeing in particular communities of color with age. We also know that the older adult, there's also longevity differences in longevity. So the 85 plus population, for example, is higher percent white than younger age brackets. So there's a lot of variables at play. But Councilmember Balducci, thank you for pointing that out. And that's one of the reasons we're prioritizing the outreach to BIPOC elders for several of these vaccine modes.
Thank you. Please go ahead.
Yeah. So Anne, if you could flip to the next slide, please. You've heard Patty Hayes, Director Hayes, talk about this a lot. We're all, I think, highly aware that our absolute number one barrier to reaching this high-risk population for vaccine is the doses coming into our county. And really, it's a national problem. You're all reading the paper, that we have a national supply chain shortage of vaccine. We hope that will improve in the coming weeks, not months, with Johnson & Johnson another vaccine coming online, as well as other action happening at the federal level. But here to our state, we wanted to be very transparent and show you the number of doses coming to Washington State, and these are the first 8 weeks of our vaccination effort in the U.S. As then what portion has come to King County. This is supposed to align with population, but we've routinely gotten less than 30% of the doses that come to the state come to King County, and that has varied from week to week. And then pulling out how many dose ones are we receiving, because the dose ones are what enable us to serve new people. So a couple things are really important to know about the dose situation. And I know Patty shared some of this with you previously. Obviously, the supply is not robust, steady, or predictable. Providers are really scratching their heads around this predictable issue, because the way the supply chain works, they really only know the very end of the week what they'll be getting for the next week. And that creates a huge amount of complications for trying to make appointments when you don't know how many doses you're going to have. The overall drop in doses, because you can see we had a high in week 6, we had 38,000, or actually week 2, we had 45,000 dose ones. This week, week 8, we estimate, and there's been some little shifting around, but it looks like just shy of only 20,000 doses in King County for this week. So this is creating a lot of disruption. You, I'm sure, are hearing from constituents about concern about can't find an appointment, or they are all filled, or my appointment was canceled. The shifting of dose, the overall drop in doses, as well as shifting of doses around, is creating a lot of that disruption. But I think the most important thing to keep in mind is just thinking some comparisons. So say 20,000 dose ones this week, that means we only have 20,000 doses to serve new people. The 1B1 population that Jeff described is approximately 300,000 people. Some of them have been served, but yet we still have some 1A not served. So essentially, we have 20,000 doses this week to try to reach somewhere between 200 and 300,000 people. So there's a huge disconnect. And if you do all the math and add up all the doses that have come to our King County in these 8 weeks, and then all the people currently eligible, and do some alignment, King County has received less than 30% of the doses needed to vaccinate the currently eligible population. So this is very important context, and in terms of expectation setting or handling the extreme stress and frustration that you or your constituents are feeling, or constituents are communicating to you. It really comes down to, we simply don't have the doses in our county to serve everyone as we would like to be doing right now.
Madam Chair.
Councilmember Lambert, please go ahead.
Thank you. I think the problem here, in my mind, is that when we say you're eligible, people immediately translate that to the word it's available.
Yeah.
So if we were to communicate that differently, to say, here's the list of eligibles that will be available after such and such date, I think that would make it so much easier, because people think, oh, I'm eligible, I'm going to go this afternoon on the way to the store. And it's not that. So I think that word eligible has caused some of this conflict. So
I couldn't agree more, Councilmember Lambert. Thank you so much. What's very difficult is that we've sort of been set up in a bad situation where 300,000 people on MLK Day were told they're eligible, and we had only a fraction of doses to make it available to them. So I appreciate your distinction. Thank you. And I want to move on, and we can walk through some of the major pockets of this population and the vision for how they will be vaccinated. We've been working to vaccinate residents and staff in long-term care facilities since the beginning, since week 1, because they are 1A eligible. And there's been some good progress on this front that you've been hearing about. As you know, the CDC has a national partnership with CVS and Walgreens, and they are doing on-site visits to many of these facilities. So our latest report today is 51 of the nursing homes, that's all of the nursing homes, have had at least their first clinic visit from either CVS or Walgreens. They estimate it's going to take 3 visits to complete serving all the staff and residents who agree to be vaccinated. And we are concerned that there's been a lot of vaccine hesitancy, particularly among the staff. For assisted living, things are also moving forward. We have, in the same vein, most of them are part of this national partnership, and 91 out of 154 have received that first visit. So that is happening more slowly than we would like, but it is in progress. The weak spot here in this sector are the adult family homes. As you know, we have over 1,200 in the county, only about a third enrolled in the partnership. We have one of our lead staff people for older adult vaccine is working furiously and really focused on finding multiple avenues through mobile teams, through pharmacies, through others to get this important high-risk population covered. I just want to call her out. That's Maureen Linehan, who is actually the former head of the Area Agency on Aging for King County. And like a lot of smart, talented people and mission-driven people who retired, was willing to be called back into duty to focus on this. And I'm just extremely grateful that she's working with us. And this is a lot of what I'm showing you reflects her work. We'll talk more about the mobile teams in a minute, but this is the snapshot of what's happening with our long-term care sector. Thank you. Before the next 1B1 group is everybody 65 plus. We pulled this data for you, and I couldn't get it to fit on the slide, but you can also see per region the 75 plus group of people per region. So I'm going to just pull out one example. So overall, know that we're talking about 282,239 people, 65 plus in King County. And of those, I will note that only about 1/3 of them, about 100,000, are 75 plus. So it really reduces the aperture, if you will, to focus on 75 plus. And that's what we're recommending in a lot of places to focus first because of that in the higher rate and higher risk. I want to emphasize, so we got this chart shares by region of the county. So I'm sure some of your districts align with these different regions. So I thought it would be of interest is what is the cumulative incident rate of COVID per 100,000? What's the total population in these regions? And then of that, how many people are 65 plus and what percent of the population is that? And I just want to call your eyes down here to Auburn, Kent, and Federal Way. If you look at that incident rate, it is significantly higher than any of these other regions of almost 6,000 people per 100,000 COVID positive incident rate. And this is underscore why we are focusing the high volume sites down in South King County in Auburn and Kent. But this data can be available to you post this presentation if it's helpful.
Dembowski.
Councilmember Dembowski, please go ahead.
Thank you, Madam Chair, and Ingrid, thank you for your work on this and this information. A clarifying question on the cumulative incidence per 100,000. Is that for the entire population or is that for 65 years and older?
That's a good question. So our data lead, Sarkis, pulled this, and I believe that's the cumulative incidence for 65 plus, but I will double check that.
That would be important, at least to me, to understand the rationale that you've been following to prioritize certain geographic areas. But if in fact it's the entire population, one might have a different next step. I'll say it that.
We will check that for you and get back to you very shortly. It's an easy thing to check. Thank you.
Thank you.
So I'm going to go really quickly, Ann, through the next slide, which Jeff explained. So it was a little complicated when the governor announced on MLK Day, 65 plus, and then this other group, people in multi-generational households. Jeff explained it well already, so I don't want to repeat. Do any of you have any questions about the call out of these groups of 50 plus individuals?
Any other questions at this point? Okay, also okay to save until the end. Please continue, Ingrid. Thank you.
Thank you. And so this should look familiar to your eyes, is this notion of a multimodal approach to vaccine delivery, that we want to meet people where they are and enable them to find vaccine in a location or an access point that makes the most sense for them and really builds on their existing relationships and community. So I'll point to a couple of these, and then we'll give you a little more detail. The healthcare system, of course, many of the doses initially have gone to healthcare system as well as FQHCs. Older adults, many of those systems are proactively sent out invitation to people by age bracket for appointment, and many older adults have been served through their PCP or a primary care provider at hospital or a local clinic. And so that's the same as what happens, say, for flu vaccine. People go, they get it at their doctor, or they go to their local pharmacy. We talked about how pharmacies were a major access point for the long-term care facilities with Walgreens and CVS partnership. Starting this week, there's also a national partnership with a broader range of pharmacy and grocery store chains. More of them will start getting doses. And some people may find it easy and most convenient to go to their Albertsons or Safeway or Costco or Fred Meyer and get their vaccine there. And as supply chains improve, more and more pharmacies and grocery store chains will be an access point. The high volume sites are really critical, especially for people for whom they are not maybe connected to the healthcare system. So it's difficult for them to navigate or understand how to, they're not part of, Kaiser and didn't get the immediate invite to make an appointment. The idea is a catchment, an open access point that's as convenient as possible, and that we really learned through COVID testing has been very popular with the residents of King County as a quick and easy access point where it's free. It's for anyone, regardless of insurance status or regardless of documentation status or citizenship status. So we'll talk more about those in a minute. Pop-ups are also really important. Pop-up clinics, you have the ability to have a quick temporary vaccine site in a community focal point where people know and trust, whether it's the parking lot of a faith-based organization, a meal site, or a senior center. We are really eager to get more doses so we can match more enrolled providers with community sites and create more of these pop-ups. We've had some going. City of Seattle has done some great ones just recently, serving Ethiopian community, as well as other types of workers in other settings. But there'll be many more pop-ups happening as the dose situation improves. For the older population, the last two modes, if you will, on this list are even more important than the general population, because more so than people of all ages, we have older people for whom it's difficult to get out to travel outside the home. People can't drive, or they don't have transportation, or they're not physically able. So mobile vaccine teams, we'll talk in more detail in a moment, critical to serve, especially, for example, all of those adult family homes around the county who didn't enroll in the partnership and where people are living and working who are very, very high risk. We are sending the mobile teams. The last group are people really literally who are physically unable to leave the house, who are homebound. Jeff and I and the team have been doing a tremendous amount of work trying to get clear information on the population total homebound in King County and different potential vaccinators for that population. I'd call it a gap right now. We don't have, it's a hard population to reach. We have a list of about 6 or 7 potential vaccinators. Some people have been served, but we're going to be putting more focus on that homebound population in the weeks to come. So I do want to and the next slide, just give a little more space to this high volume site. So people know that on Monday, we opened the big sites in Kent and Auburn. They have proven immediately to be very popular, as you might guess. The Kent site is fully booked at 500 appointments per day for the next 2 weeks, and Auburn are nearly booked. Jeff, I want people to understand the outreach that we've done, enormous amount of outreach, focusing on BIPOC elders and people who can't live independently and the most highest risk of older adults to get them appointments at these sites. Would you be okay to speak to that?
Yeah, absolutely. And thank you. So at at our division, our Aging and Disability Services division, again, we run the AAA. And part of that is we sort of operate sort of the case management program for people who are living at home who are in need of some level of care. And so we have, in South King County, we have about 4,000 clients who sort of meet that eligibility, who are being case managed. And when this pop-up site was announced to us, then we, our case managers, along with, we have 4 subcontracted agencies who also provide case management. We got on the phone and just started calling all of our clients and scheduling appointments. So that was just an amazing sort of job by all of those individuals, but really, really appreciated by the clients, because literally we walked each and every one of them through the scheduling process to make that appointment. So we reached out to about 4,000 people. We scheduled about 1,100 different clients. And then there was probably an equal number of caregivers for those clients who met eligibility, who we also scheduled. So that, again, 2,000 plus individuals. And, and people were so appreciative. We have one client who is a member of the Somali community. And we have one of our nurses who also belongs to that community. And she reached out to one of her clients who said, no, I don't think so, because I'm hearing a lot of other folks who are not wanting to get vaccinated. And then about a half an hour later, a little bit later, she got a call back saying, no, I think I need to get vaccinated, because evidently there was one of the leaders in the community brought people together and said, everyone needs to really encourage them to get vaccinated. So all of a sudden, all of these calls where people had said no, all of a sudden everybody had called back saying, okay, I want an appointment now. And so, that's very personal outreach, as well as that connection to community leaders, is so important to this whole process. Thanks, Ingrid.
Jeff, thank you. Thank you so much. And it was really like the Chinese Information Service Center, ACRS, Neighborhood House, the community, the navigators who are community leaders, primarily in BIPOC communities who work with public health. It's been an all hands on deck effort to ensure that we're providing that sort of personal assistance and support to drive our very highest risk BIPOC elders, 75 plus, and other high risk individuals to this vaccination opportunity. So we're very happy to have these open and hope to serve, continue to serve, at a large number of people. We'd love to have more doses so we could do more. There's plenty of room at these sites to do up to 2,000 doses a day. Right now, we're only running at about 500. Thank you. But again, there's a lot of people that can't get to these sites. We need to go to them. So we do have 8 mobile units in the field as of today. One is really a leader in this has been Seattle Fire Department. And Jeff, do you want to say a word about Seattle Fire? Then I'll give like the bigger picture of these.
Absolutely. So as you know, Seattle Fire, we're getting about 1,000 doses a week at this point in time. Initially, we went door to door to all the adult family homes in the Seattle area. We got the vast majority of them. There's still a few that are outstanding, but did initial vaccinations with all of those individuals and have scheduled their second one that will be coming up in a week or so. Our next focus for the team has been really looking at senior low-income housing buildings around Seattle. So we've gone out to a number of these buildings. We set up tents and inside the lobbies and bring people down. It's a partnership with both the housing provider, such as SHA or SCIPTA, and our case management staff, who also work with the clients in those buildings and do a little preparation, which we found is super important. Just talking to folks about the vaccination. And then the day of, they literally go floor by floor, bring people down only as when their time is needed. So therefore, we're keeping people as safe as possible prior to vaccination and doing an entire building at one time. So that is sort of the focus of Seattle Fire at this point in time. We are also, again, we did an adult day health program as well, and are also doing programs that serve seniors, but mostly individual seniors who have recently experienced homelessness and are in specific buildings in mostly the downtown area.
Jeff, thank you. And the model that you're hearing Jeff describe is happening not only in the city of Seattle, but across the county. So we are very grateful to be partnering with the Bellevue Fire Department, which is covering not just Bellevue, but a wide terrain of turf on the east side of the county, as well as Puget Sound Fire Authority, who are running mobile teams throughout South King County, as well as mobile teams we've launched ourselves out of public health, who are primarily focusing on South King County. And now we have in training Shoreline Fire Department, who are in training this week. And starting next week, we'll start to serve both the adult family homes that Jeff was describing, who are not otherwise being served in Shoreline, Bothell, and the surrounding areas. So we're looking at all the folks in the county for whom leaving the house is a challenge, and looking for where the model makes more sense to go to them, whether it's an adult family home, permanent supportive housing, or senior housing.
Can you pause there for a second? This is Claudia. I don't know if I'm previewing future slides, but this is an area where I think all the members are probably receiving a lot of questions. I know I am. And so how would people know that a van is coming or get themselves, like listed to have a van come to, like, if you're just a housebound senior who receives help in your home and aren't at one of these family homes? And what if you live outside of Bellevue on the east side? And can you just describe a little more about how we're going to identify people and how will they know? I feel like the main question I get is about information, that people just don't know how to get, they're eligible and they don't know how to get connected to an appointment. They don't know how to go to find a place. There are no appointments at any of the sites listed on our website. They don't know how, or maybe they're not allowed to access our mass vaccination sites because they don't live in the right part of the county. They don't know about these vans or how to get, so there's just a ton of frustration and confusion. And how are we going to get information to people so they can, I think people will calm down if they understand their turn is coming and how they will know their turn is coming. But that's a whole lot of the frustration that I get, is that I have no idea how to get information or how I will ever get in line.
Thank you, Councilmember Balducci. You're right. That was totally the next topic I was going to go into. So happy to. Let me answer the specific question on how do you know if a van's coming to you, and then the bigger question of, just how does someone navigate this complex world and this shortage of doses. So in terms of the adult family homes, we have a comprehensive list of all adult family homes. We know which ones are enrolled in the partnership, which ones aren't. We've taken the list of which ones are not otherwise covered or being served. And then we're doing a matchmaking matchmaking process. So we have a staff person, the person I mentioned previously, who is doling out the turf, if you will, of uncovered adult family homes to these different mobile teams, as well as to some pharmacies who are willing to serve those adult family homes. Then they get advance notice that a mobile team will be coming. And as much as possible, we get them prepared with paperwork so the visit can go as quickly and smoothly as possible. Same thing happens for low-income housing of different varieties. There's a staff person at the AAA who works with Jeff, who has a complete inventory of all different types, King County Housing Authority, SHAG buildings, all different types of low-income senior housing around the county. Keeping that inventory, trying to rate it per a vulnerability index to understand where do we have our most, highest rate of BIPOC elders, or where have there been outbreaks, or where are people lowest income, and then scheduling these same teams to go out to those buildings. And then we have UW social work students now who have volunteered, and we're working on a system to set them up to help be the advanced team to go out to the building and say, the mobile team is going to be here Tuesday. Let's find out in advance who is willing and interested in being vaccinated, et cetera. So if you have particularly the low-income housing buildings in your district that you're really worried about, I think feel free to call our attention to those. If you've had, a lot of constituents who, if there's been outbreaks there, if they meet these criteria and you're really concerned about them being served, call them to our attention and we can check where they are on the list and understand the sense of urgency. So that's the narrow question. Anne, if you don't mind going to the next slide. For this, how do I navigate this complex world?
Yeah. Ingrid, I'm sorry. I was thinking about what you said. I hear a lot of, we are thinking as system actors. This is how we figure out where we need to go, how we communicate that to the people who are going and vaccinating. And we know that we need to communicate with the places that we're going so that we can coordinate. What I'm not hearing is put yourself in the shoes of somebody who's waiting to learn when their turn is. There seems to be no way that we are mass communicating with people and putting out there a clear order of when things are happening and when and how they will learn about them. Like, it's all from the perspective of the system. And I'm asking about the perspective of the constituents who are really stressing out. Like, I'm getting up at midnight and getting online. I know. How can we help coordinate so that people know what we're doing? Because right now they think we're not doing much of anything, truthfully, because they don't know. And that's not their fault that they don't know. We're clearly doing a lot of stuff. There's a huge gap in between those things. And I'm very concerned that we do not actually have a way to fill it.
Yes, definitely. I hear the frustration. I think people of all ages are feeling that frustration. And it's most urgent for older adults because people realize how high risk they are if they test positive. So to your question, right now that we're operating in a scarcity world where there are only a fraction of the number of vaccination appointments available for those who are eligible. So that makes all of this more difficult and challenging. It's just going to continue to be challenging for a number of weeks. But in terms of I want to share a few things, and I think it's helpful but not sufficient. So I'll share what is now and what we're working to make it be. So the first is we have a ton of information, as you know, on the public health website, and our staff is supporting you and your staff in how to connect your constituents to that information. To schedule a vaccination, people should first get in touch with their own healthcare provider. Again, the health system is the major access point at this time. Second, they can use Phase Finder. Now, recognizing that many, many people, particularly older people, don't have access to technology, or even if they did, might not feel comfortable using it. So one option is Phase Finder, and that, you've probably all done it. You go in, you answer the questions, it tells you if you're ineligible yet, and then it points you to a list of links of potential places in your area where you could get an appointment. Well, if you're unable to access that online, you can also call the Washington State Department of Health. The good news on this hotline number, which some of you may have tested yourself or Secret Shop tested, is it's massively improved in the last 10 days. So they've added a ton of staff. And what I'm really happy about, and it's in multiple languages, and it's on weekends and state holidays, the most importantly, the staff who are staffing this call line are now able to drive the keyboard. So if I call in and I'm 82, I'm not super comfortable with computer systems, I'm not just going to go to this website and click on this link. I'm going to have someone tapping the keyboard at the other end of the line, helping it get through for me to see if they can get me an appointment, maybe at the Kent or Auburn site or somewhere else. So that is definitely improved. The challenge is, because of the dose shortage, that person on the other end of the line may not be able to get the person an appointment. But this is the current state of play of what exists to help people navigate, where do I go to find a vaccine? I call my doctor, I get online if I can't, or I call this number. So we're looking at a number of options to make this better. The first and foremost is working with community partners. And if you can go down 2 slides, that would be awesome. So these are all partners that the Area Agency on Aging and Public Health and others. This is just a subset. We're actually been working with a lot more folks, because what I shared with you, Councilmember Balducci, is totally unsatisfying to have to just call an impersonal line and then not be able to get an appointment. People, especially people who don't speak English or who don't navigate systems well need more personalized, hands-on support and assistance. So working through all these organizations listed on the slide have been supporting and helping people in their communities to navigate this complex world, this scarcity world, and do their very best to help connect these individuals, all these BIPOC elders and others who they're in connection with, to appointments.
So what does that mean? What are they actually doing, Ingrid? I've not heard of anybody who got actually helped. They either got lucky or they didn't.
So these organizations have been calling their members or their affiliates. Several of these groups here, and Jeff, you're better at explaining this than I do. They run the family caregiver support programs. So people who are unpaid family caregivers is a target group. They're calling up folks and saying, hey, we just had 2 new high volume sites open in Kent and Auburn. Are you interested in making an appointment? And then just doing it for them. And that's also what the case managers of people who can't live independently without assistance are doing. So it's hands-on for the very most vulnerable older adults by proactively contacting them and asking if they want to get vaccinated and helping them sign up.
Mm-hmm. The other, if I can jump in here, a resource is called Community Living Connections. And that is sort of like a 211 line specifically for older individuals in Seattle and King County. And that is their role, is to really help individuals specifically navigate resources. Obviously, at this point in time, they are also trying to help people to the greatest extent possible around vaccine appointments and literally sort of walking people through the process themselves. So if they, again, can't get onto FaceFinder, that they will get onto FaceFinder with them. But again, what they are running into, obviously, is the same thing that everybody else is running into, and that is just not the availability of appointments. But that is a very direct process by which somebody can help someone schedule an appointment.
Up the Grove?
Councilmember Up the Grove, please go ahead.
Thank you, Madam Chair. I'm kind of backing up a few slides. A couple just real quick technical questions. I'll rattle them off real quick. Ingrid, you mentioned that the Kent site is booked, but when you mentioned Auburn, you used the word nearly booked. Is there a way for people to get appointments at the Auburn site?
That information changes by the moment. So if people go, so the link is posted on our public health website to register.
The link says no appointments available.
Then that would be true.
Okay.
The
second one is there a mechanism for a quote unquote wait list? I had the opportunity to tour the site, and I know how they're in some ways how they're using, if extra vaccines become available, there's a good plan in place. Is there a mechanism for a high need citizen to proactively get on a backup or call list at those sites?
I love that question, and it's important. In fact, my own parents there live in Montana. They had a public health high volume site. They got on the wait list, and they started calling back the wait list in age order. So my parents are quite old in their mid 80s and got called because they were one of the first calls because it was done by age. But we don't yet have a system set up for wait list. I think because this is the first week out of the gate for those sites, but I think it's a great suggestion, and I'm happy to bring it back to the team.
Okay, and the final one's an even easier one. You mentioned if we were aware of senior housing in our districts that had an interest or thought should be a priority, you said to reach out. Who specifically should we contact?
I think that would be best to go to Jeff's shop because they're handling that inventory list. So Jeff, do you want to recommend a specific person, or do you have a generic box, or what's your best approach?
I think the best approach actually is just to get in contact with me or Maria, so we can put our email address available for folks to do that.
Thank you. During the briefing, I had received a communication from a facility, so I just figured I'd ask. Thanks. Thank you, Madam Chair.
Zahalai.
Thank you. Councilmember Zahalai.
Thank you, Madam Chair. Thank you so much, Ingrid and Jeff. I want to go back a couple slides as well. I saw earlier that undocumented people were mentioned under a row saying that undocumented people can go and receive vaccines and make appointments at our high volume sites, but that's the only place that they were called out. Does that mean our undocumented neighbors can only go at high volume sites, or where are they eligible to go?
So the vaccine currently is available regardless of insurance status or documentation status, definitely the high volume sites. Also, the documentation status would not matter for a mobile vaccine team or for many of these mechanisms. For the healthcare system, currently, unless they're serving open access community, if they're just serving their own established patients, then they need to have, some of them are billing insurance and some are not. There are many people who are undocumented who are insured, so they could also access through the healthcare system. So there's none of these modes would overtly refuse to serve someone who is undocumented. I think some of the federal funding coming would technically not reimburse for someone who's undocumented, but there is not a mechanism to do a lot of tracing on that. So I think in general, I would say documentation status is not a barrier to getting vaccinated. The high volume sites are just one of the easiest, most convenient. People know that they can go and it's free and they don't have to worry about insurance card. They don't have to worry about anything and they will get served. But I think the access for people who are undocumented is quite wide. Well, actually, let me correct that. Access for everyone is limited, including undocumented, but not more so.
Thank you so much. And then can you confirm who is eligible to use the South County high volume sites? We have one area in my district, Skyway, they're 98178, and they're showing as not being eligible for those sites. Is there a cutoff point or anything that people should be aware of?
Oh, yes, thank you. And could you move to slide the one after with the phone numbers on it? Yes. Okay. So this is our some prioritization for the older adult plan generally. So I just wanted to share this since I hadn't gotten to it yet. But most specifically for the South King County sites, what we're doing with those sites is trying to narrow the aperture, if you will. So instead of saying these sites are open access for anybody across the entire King County who is currently eligible, that would be 500,000 people. Well, 200,000 already been vaccinated, so at least 300,000 people. So if you all have 300,000 people vying for 500 slots a day, access is going to be super challenging, and people with the best digital access and know-how are going to get the appointments. So to prevent that from happening, we took an intentionally equitable approach and said, first of all, let's narrow the aperture by saying we want to make appointments available first to people 75 plus. And we want to focus geographically where the incident rate has been the highest, which is right around these two sites, as you saw from that other chart. So there are specific zip codes there's a screening that you go through to get an appointment, and it will ask, are you 75 or older? Do you live in South King County? And then the back end of the program has the zip codes. I don't have that. We can share with you what that list of zip code is, but the intent is to focus in South King County. If there are pockets that are being left out that you're concerned about, happy to take that back to the team.
Thank you so much. I think it's always been ambiguous whether Skyway is in South King County. I think it's probably not, but just wanted to confirm for the people who are asking. And then
maybe Ann and I can make a note of that and take it back to the team for a question and consideration.
Okay, thank you so much.
Thank you.
And then last question, if that's okay, Madam Chair. All right, thank you. Just going back a little bit to Dave's question as well, but when people go to sign up on the vaccine website and it shows that there are no more appointments available, I haven't tried to sign up myself, but does it tell people when there will likely be room for another appointment? Is there a way that we can signal to people when they should come back or how they should keep track? Because I think we're getting situations where a lot of people are going and immediately stuff is booking up and they're not getting any kind of follow-up information. They're not getting any kind of understanding of when they can come back, what they can do to position themselves to get vaccinated in the future. What information is available that we can provide at that point?
Well, first of all, I just want to recognize how incredibly frustrating this is for people. I mean, literally, especially for elders, the vaccine is life or death, and people so want that protection. The reason that there's not more information is because we don't have the information. So the doses are not only a very small amount, 20,000 doses for 300,000 people, and then week to week we have no predictability. We only find out on Friday. In fact, this week we found out on Saturday how many doses we will have for the following week. So we weren't sure that we'd have the 3,000 doses per Auburn and Kent that we got, but we were hoping that that would happen, and it did. But it just makes it impossible to schedule out into the future when you don't know what the future holds. So for your constituents or anyone, loved ones, I would say just repeatedly keep checking back.
Thank you, Ingrid. And are we already providing that level of transparency when people are trying to sign up? Do we tell them about this lack of ability to forecast and things like that? Or does it just say, booked up?
Jeff, you're nodding. Do you want to explain what?
I was nodding to the fact that,
how frustrating it is. Yes.
Yeah, how frustrating.
Yeah.
And there is no good way to take waiting list or anything like that at this point in time. But go ahead, Ingrid.
Well, I'd have to look myself at this link. I've gone through it a few times myself, but it's due to limited supply. At this point, we're limiting appointment availability. But there is not clear information about when more appointments will be made available because we don't know.
Yeah, I think we just need to tell constituents everything that we know. Like, even if that is the gaps in our knowledge because of things being out of our hands and being with the federal government, whatever information we have, I think that should be there on the websites, letting people know. Otherwise, it just feels like we're, just not doing everything we can to get them vaccinated.
Yeah. And we really ask for your support in that expectation setting. The doses chart that I shared is like, hey, here's full transparency. Here's what comes to Washington. Here's what comes to King County. Please, everyone understand we have 20,000 doses for between 200,000 and 300,000 people eligible right now. And we only know week to week what's coming. So we try to integrate that key message about scarcity of doses every time we're out there talking to the public, as well as it's all over our website. But as elected leaders, we really need your help and support. And, both empathizing with people. Yeah, it's frustrating. It's maddening. My loved one needs protection. And then helping them understand why there aren't doses immediately available for everyone.
Will do. And just confirming, can we put that on the sign up pages if people are unable to get an appointment?
Yeah, why not? So Anne, help me here. So we'll think about going back to the team on what the interface looks like. Our communication staff put together the website that leads to the link. Let's take another clear look at that and see if there's language we could add to speak to the reason why there's a lack of availability around shortage of doses.
Thank you so much, Ingrid.
Yeah.
And Jeff.
And Councilmember Zahalai, I will take one constituent off of your list, my 95-year-old mother who still cannot get an appointment, but I will explain to her why.
Thank you so much, Jeff. And I'm wishing your family member all the best.
Yes.
So Councilmember Balducci, we've taken up a lot of time. I just want Anne to show the last slide so we can end with a sense of accomplishment of what has been achieved. This is the doses delivered by age group. So that 75 plus year old age group that I talked so much about, we so far to date have a little bit over 30% have received the first dose. So we're onward and on the way. We need to get that up to 100% as soon as possible. And then you can see as follows, it's about a little less than 30% for that second lower age bracket. And we've sliced and diced this information in numerous different ways, which we can share at request, but I just wanted to share that. And then finally, Anne, the last slide is there's 3 basic keys to success to reaching our older adults in King County. One, we talked incessantly about the need for a robust and predictable supply of doses. The second is easy to use systems to book an appointment, to know what's out there, how to access a vaccine, how to get an appointment. And the third is partnership, is really intentional support for the most vulnerable, highest risk amongst our elders to help them get where they need to get vaccinated. So that's what we have. Thank you.